Stories shape how we see the world. Voice of Witness is an award-winning oral history nonprofit harnessing the transformative power of storytelling. We work with individuals and communities impacted by injustice, helping them document their lived experiences through oral history, telling their own stories in their own words. In an era of reductive sound bites, we need this kind of nuanced grassroots storytelling to create a more just future. Visit voiceofwitness.org/learn to get involved, check out our workshops, and download tools to support your own project. Join us in building a more connected world, one story at a time.
Hi, I'm Rashmi Sajani, founder of Girls Who Code. Look, I'd consider myself a pretty successful adult woman. I've written books, founded 2 successful nonprofits, and I'm raising 2 incredible kids. But here's the thing. I still wake up wondering, is this it? And if the best years are yet to come, when's that going to start? Join me on My So-Called Midlife, my new podcast with Lemonada Media, where we're building a playbook for navigating midlife, one episode at a time. Each week, I'll chat with extraordinary guests who've transformed their midlife crisis into opportunities for growth and newfound purpose. At some point, we all ask ourselves, is there more to life? I'm here to discover how to thrive in my second act, right alongside you. My So-Called Midlife is out now, wherever you get your podcasts.
Lemonada.
Hello and welcome to Good Things. I'm Travon Free, and thank you for joining us for a special 4-part series with the Coalition to Advance Public Safety, also known as CAPS. CAPS is a collective working to expand and strengthen the community violence intervention ecosystem by providing resources, technical support, and sustainable infrastructure to intervention programs in cities and communities most impacted by gun violence. CAPS is made up of 4 national support organizations who partner with community violence intervention teams in Baltimore, Maryland, Indianapolis, Indiana, Newark, New Jersey, and Baton Rouge, Louisiana. And they've just announced partnerships with 4 more cities. Today, I'll be talking with Joe Kim, the Associate Director, Training and Technical Assistance at Health Alliance for Violence Intervention, or HAVI. HAVI has been a significant force in combating violence in Baltimore by combining the efforts of medical staff with community-based partners to provide safety planning and trauma-informed care to victims of gun violence. Also joining us today is Freedom Jones, the Director of Community Violence Intervention at LifeBridge Health, a health services provider centered on improving patient health, preventative services, and educational programs. Joe, Freedom, welcome to Good Things. Joe, I want to start with you. What I noticed throughout learning about the Health Alliance for Violence Intervention is, it's really a survivor-first organization, and it meets survivors where they are. At least that's how I see it. And so how would you explain the work you guys are doing?
Yeah, thanks. I feel like it's happening on a few different levels. We're a national organization that's membership based, and really our strength, I think, is in our membership. And what we're trying to do is really highlight the incredible work that's happening on the ground in communities, in partnership with hospitals, and highlight some of the learnings that we kind of get from those folks, and try to highlight some best practices. And along the way, we focus on advocacy, promoting the field, some best practices, some standards, around the quality of work that's happening, and really uplifting, I imagine we'll come back to this quite a bit, but really the strength of the frontline workers in this field, and the sustainability, the wellness of their work, as such a critical part. And so that's, one piece I think we are really trying to continue to explore and advocate for, as it's a, really a critical piece.
No, that's amazing. It's really remarkable what you guys do. And, Freedom, to pivot to you a little bit. When you hear that violence is the leading cause of death among Black boys and men, how do you define that violence?
Oof, the leading cause of death.
I know, right?
That is the definition. It's wow, that's a pretty amazing statement. That to me is defined as a huge problem for Black and brown folks as well as our country. And it should be the number one focus in terms of providing what I consider cure for a public health approach to doing this intervention. And I call that urgent.
Right. Absolutely. Now, like we know that violence, kills thousands of Americans each year and sends more and more to the hospital with life-threatening injuries. And of course, the Black indigenous communities are disproportionately affected. And why don't you think we treat this as a public health crisis?
I feel like part of it is, if we're looking at the history around community violence, and historically how it's been addressed is, through conventional approaches, which was highly, criminal justice focused, right? That it was a punitive kind of strategy for addressing community violence. And I think a lot of how we operate in both healthcare and across our systems are still kind of attuned to that. And, unfortunately, a lot of that is steeped in a lot of structural racism, a lot of implicit bias that, folks experience in healthcare. Yeah. And I think there's these really dangerous kind of stereotypes of survivors of community violence that they're either kind of perfect victims or they're like someone who deserved it or like was asking for it. Mm-hmm. And I think both of those are really problematic. And because of that, I think a lot of folks tend to chalk off survivors or victims of violence, because somehow they were responsible for their own injury, right? And right. I think it's easy for folks to then just kind of like dispose of or try to erase their stories and their experiences within the healthcare field. It's because they're Black and brown folks, right? It's because they're poor folks. It's because they're folks that, often are the ones marginalized from our systems, that it's easy for us to, as kind of systems as a whole, continue to forget about those folks.
I think the root cause of things often is not addressed. It's a lot of work that needs to be done and unpacked around getting to the root cause of a lot of areas of racism. So, it's interesting because I think the reason that LifeBridge Healthcare, which is a huge healthcare system, is really doing this is because they do a survey, an annual survey. And that survey is a, healthcare survey. And in Baltimore, the top issue for folks here in Baltimore was violence. And so that's how it became, a part of the health concern for a healthcare system.
Joe, you've been doing this for about a decade now, working in communities, and youth when it comes to violence and violence intervention. Has it always felt like a revolving door of violent injury in communities to you?
Honestly, I feel like in my experience, both as a direct service provider and now, from kind of working with partners and in different communities that are experiencing violence, I think, there are definitely a lot of similarities, right? Like, the kind of like concentrated poverty, the lack of resources, those kinds of things happen in a lot of communities around the country. As a result, one of the symptoms of, community violence exists in a lot of similar ways. But I feel like it's important, and something that I think gets lifted up through, some of the work that's happening is that violence is beyond just like community violence, right? Like the violence that survivors experience through healthcare systems, from law enforcement, from, medical bills, it's all violent, right?
Right.
And a lot of the work that violence intervention folks do on the ground, is intervening in a lot of those things. And it's not always just trying to stop the beef.
Right.
Sometimes it's helping someone navigate insurance so that they don't lose their home, right? Which is another kind of level of structural and systemic violence.
Yeah.
And so, I feel like the work is really complex in that way. And the work that folks do on the ground is really complicated and comprehensive. So I feel like that's, I think we have to like blow up the definition a little bit around the violence that folks experience and the really complicated work that folks are doing on the ground to help mitigate or intervene.
I think when we are pushing for this issue to be a public health issue, it really helps destigmatize some of the layers that are connected to violence. Because like Kim said, it is so intertwined. There's so many layers. And so, the revolving component can't be isolated. You can't fix one part of violence without connecting to the other part of the whole, all the things related to the cause. So, that's why being able to look at this work in that way allows us to address it co-partnering, comprehensive, holistic, so that we can connect with other places that need to work together to address the revolving component.
Right. Absolutely. And both of you guys can feel free to answer this, but more geared to the work you're doing, Joe, what do you think from what you see is missing when it comes to what young people need to do more than just survive when it comes to this violence, but to actually like thrive beyond it? Like what do you think is something that is just not there for them?
Yeah, I mean, I think this goes kind of back to what I was sharing earlier, that like, I think our approach used to be this kind of like a attitude shift, right? Like if we just get folks to like change their mind about community violence, then all of a sudden structural racism is solved in our communities, right? Like the reality is that like it's a community effort, right? Like if we are really trying to get to the root causes of things, the compounding trauma that folks experience in communities is not going to be solved by one program or by one super caseworker or by one hospital. It's really the conditions, the material conditions on the ground for folks have to shift, and that's got to include everything from safe housing to access to education to access to employment opportunities. And so I feel like that's where our work is looking towards, right? Like, and I think Freedom spoke to this, that the kind of breaking down of silos, the really deep intentional partnering across systems to create really better social nets and supports for folks that kind of end up in these situations. That I feel like that's really what it's going to take.
We're going to take a quick break, but we'll be back with more good things.
Interested in the power of first-person storytelling? The Voice of Witness book series documents the oral histories of people directly impacted by and fighting against injustice. Each collection supports historically excluded communities to tell their own stories in their own words. The books feature a diversity of voices, including those of refugees and immigrants, incarcerated people, communities displaced from public housing, farm workers, indigenous peoples, and more. These powerful stories highlight crucial issues and expose the impacts of harmful narratives and policies, laying the groundwork to build solidarity and movements for change. Voice of Witness books are read and used by thousands of educators, organizations, and advocates across the country each year. Visit voiceofwitness.org/read to learn more, access free resources, and get involved.
Hi, I'm Emily Deschanel.
And I'm Carla Gallo, and we're excited to tell you about Boneheads, our new Bones rewatch podcast.
I played Dr. Temperance Brennan.
And I played Daisy Wick, and we are going to watch from the very beginning.
We're going to watch the episodes. We're going to reminisce. We're going to laugh. We're going to cry. We're going to tell behind-the-scenes stories.
We're going to go on tangents.
A lot of tangents.
So whether you're a seasoned Bones fanatic or a newcomer looking to dip your toes into the wild world of forensic anthropology, this show is for you.
Boneheads from Lemonada Media is out now wherever you get your podcasts.
I mean, listening to what you guys are saying, it's got me thinking, the way we talk about and the way we frame these problems can also contribute to how much help and resources we have around them, right? So like when you think about why we wouldn't treat a gunshot victim the way we treat a heart attack victim, like why don't you think we see, because of the effects of the trauma that goes along with those experiences, we treat victims of violence like people we see in the hospital and throw them right back on the street as if nothing happened to them. But a heart attack victim, it comes with all of this post-care and things that go along with trying to better your life and sustain your life. Why do you think that is? And do you think it is something that can be changed with how we reframe the conversation around these kind of things?
I feel like it's a couple of things come to mind. One is I feel like our healthcare systems are kind of wholly unable to effectively meet the needs of folks that are victims or survivors of community violence, right? Like we don't got it right. We don't have the resources. We don't have the capacity. Anyone who works in any healthcare system will tell you that they're maxed out, right? Like they're just like, we're so far from meeting meaningfully the needs of folks that are survivors of community violence. So I think there's one is that's on all the healthcare kind of system as a whole. That is just like, we're not very good at treating a whole person, right? Like if you have mental health issues, you go down the hall. If you need a foot doctor, you go, to this building. But like the reality is when we treat people, we're treating an entire individual, and we don't really have a system of care that can address that, right? That can like look at an entire person and say the head's connected to the body, and the thing that's happening in your gut is connected to maybe some of the trauma that you, right? That we have no system of understanding that. And then again, even more so for Black and brown folks, or folks that where people feel like they're not maybe even deserving of the care, right? Like they don't even deserve the dignity of treatment, because they somehow they like did it to themselves. So I think both of those compounded, kind of is what we're looking at.
Yeah. It's so interesting because the healthcare system that I am in, took on a lot of street teams. They have 2 hospital responder programs that are really comprehensive. At bedside, gunshots, human trafficking. We use the same approach around gunshot victims with we do elder abuse. And so it's that bedside credible messenger intervention. And to do that, you in order for folks to really see this as a resource, to see the hospital structure, I'm saying, to see that as a resource, there's a lot of education that has to go on within a hospital system. Heart attacks are things that people have been talking about and value for a long time. You understand? Because it has affected not only Black and brown, but it's affected. So now you have gunshot victims that are now affecting other race. Their violence is unfortunate that it is affecting a lot more now. So there's a lot of education in the healthcare system that I have to do to help them understand the root causes, why this work is done, a whole lot of education from doctors to nurses to head of hospitals, so that bridge between what this issue is and the care and continuity of service begins to happen. And so and let me tell you, when LifeBridge took on all of these street teams, I mean, we will have 16 men and women who are on the streets doing this work, working in partnership with our hospital responder hospital staff responder programs. And that's a huge lift. And it's not, most hospitals don't have the robust street team. So in order for them to understand how this process, this care, public health approach should happen, they have to understand this work from not only a bedside intervention, but from a policy place, from a legislative place, from a financial So now they're at LifeBridge. We've had almost this year a 50% reduction in gunshot victims coming into the hospital because we're doing some good things. They see the dollar savings in that because now the effects of the emergency teams don't have to their attention can go to other things. So they're seeing, okay, what's going on here? So that opens up an opportunity to educate people about this public health approach to violence, to educate folks around the root causes of some of this. So a whole lot of education. And that is happening because, one, we have a hospital violence intervention program in 2 hospitals. And leadership in a healthcare system sees the value of how this is impacting everybody.
Mm-hmm. Absolutely. No, that's a great answer. And Joe, to piggyback on that, could you share a story of what hospital-based intervention care looks like in action and in the work that you do, or how you see that playing out? Or if there's a unique experience that you've had.
Yeah, I mean, I might pitch it back to Freedom. I mean,
I could do it. Yeah,
sure.
Yeah, I have 2 teams, 2 hospital responder teams, one at a trauma center and one at not a trauma center, but more of a communal hospital. So in the trauma center, for us, we see it as a intervention with credible messengers who've been there, done that, meeting at bedside in what we consider a golden hour at bedside. You come in with a gunshot, you understand that's not life-threatening or life-threatening, because, eventually you can meet at bedside. But you come into a hospital with a gunshot and you see somebody who can meet you there, who has been through the same scenario with you, who can then connect with you about keeping you safe first, keeping your family safe, because we have a street team that can go to your house and make sure there's no potential increased violence. And we can also be outside of the hospital because we know your people might show up at the hospital because they're concerned about you, which could escalate more violence in the street. And most of all, we can provide wraparound and case management with you while you heal to help you make better decisions, because that's a golden hour. I can share a story. I had been on the streets as a director of a safe street site here in Baltimore. And this is a story. I had to put my finger in a brother who was shot, on the street because he was bleeding out. And so the team got there. They took him to the hospital. We had a street team, a responder team at the hospital. They met him at bedside, and this brother was hurt. So about 2 or 3 weeks later, because I was there, he knew me on the street because I was a street team person. He knew me. He knew I was there for him. I could go to the bedside, talk to him, and we could both cry. Okay. And I can give him a mirror to look in that mirror and see himself, to say, what can we do better? How can we make better decisions? What do you need? How can I help you heal? How can I get you back to the doctor so that you can get the appropriate medicine that you need to heal? Because sometimes people don't want to come back to heal. And this brother looked at me and cried and changed his life. Do you understand? And that is the only reason, I believe, is because we had something in common and could use that hurt, that pain, to reshift a thinking to do something different so that we don't get back into that same scenario again. And that's a true story. And so that's the way this work is done, although the men and women who meet at bedside may not be on the street, because that is not a norm. They have the experiences of, I may have been shot, I have been there, I've done that, let me use my life to help you. But they are the connection to the shift and the change with a plan, with a strategic, organized, life-changing, walking, holding your hand, helping your family, keeping you safe, change your life plan. That's how a credible messenger or a violence responder bedside intervention happens.
That's an incredible story. I mean, I couldn't imagine having to stop somebody's bleeding with my finger. I'm one of those people who, when there's too much blood, I might faint a little bit. So you're a much a much stronger person than me when it comes to that kind of thing. And I grew up in Compton, and I saw a lot of community violence, a lot of it. And to hone in a little more on the regional aspect of the work you're doing, Freedom, you think about a place like Baltimore, a place that so many of us in this country and globally, our perception of it has been influenced by things like The Wire, right? Things you don't go to Baltimore and experience the myriad of textures of a place like Baltimore. Ooh, you experience, the David Simon version of Baltimore, for better or worse, right? And and you think about what you see on social media, and there's like accounts devoted solely to the violence in Baltimore, and what do you think, because of the perceptions of a place like Baltimore, how do you think it being somewhere people think of as the most dangerous city in the country and all these things, how does that impact or influence the work you do?
Well, I think that is changing. There's been a lot of media now. Baltimore is leading the country now with its, big ups to the mayor's office, big ups to the street teams. There's a lot of good work happening in Baltimore. So that shift of what Baltimore is really about, we're seeing now as like, oh, let's check in. Let's look to see what they are doing, because they're now leading a lot of people in the country with its violence reduction strategies and plans. And so, let's talk press as a whole in this work, because that's something that is often, not really looked at. Negative press, bad press, misconception can hurt someone so much so they can lose their life. We struggle here. We're looking at how we offset some of that negativity by doing some creative things, and I'll share a little later, but that impacts the safety of staff. Perception in media could be used as a tool to hurt, or can be used as a tool to help. And so what we need to do, and we're trying to do it better in terms of a marketing strategy in this work, and help people understand that we need to highlight the success. The Wire is the deep dark, but we need to hire the good work. We need to highlight the positive stuff that is happening. The things that people are doing every day, risking their lives. The street teams who are intervening, and the numbers are going up. So we're not doing that enough, and we're trying to get better with that. So the impact of social media, the impact of perception, the impact, if we don't strategically develop the good stuff and market the good stuff, then that definitely takes an effect, and it spreads. And so I think one of the things that we are doing better is starting to highlight the positivity. We're looking at digital violence response as a whole. We're developing digital violence response. And so we're partnering with some good folks like Street Pause to deploy with a call center based on an escalation in a social media situation, and do violence prevention on the street. But what I'm saying is that we recognize that we have to flood with good stuff, marketing strategies to express good stuff to offset misconceptions and negativity. So what's happening now, there's a lot of people on the street saying, we're proud to be in Baltimore. We're excited to be in Baltimore because we're leading the charge.
Absolutely. I mean, I think that's exactly how you have to go about it is, you have to push back on that narrative and do it in the media, because the media is such a powerful tool, We need to take a quick break, but we'll be back with more good things in just a minute.
Want more from your favorite Lemonada Media podcasts while supporting the shows that help make life suck less? Subscribe to Lemonada Premium today. As a subscriber, you'll unlock exclusive bonus content like never-before-heard interviews, behind-the-scenes moments, bonus episodes, and so much more. It's easy to sign up no matter what podcast app you use. On Apple, you can just click the Lemonada logo in the Apple Podcast app and hit subscribe. For all other podcast apps, head to lemonada.supportingcast.com. lemonada.supportingcast.fm to subscribe. That's lemonada.supportingcast.fm.
Want a sneak preview of hot new audiobooks? Then check out Your Next Listen, a new podcast from Lemonada Media and Simon & Schuster Audio. We've got everything: the hottest new thrillers, best-selling celebrity memoirs, and swoony romances. And these aren't tiny clips either. They're entire chapters you can listen to. Your Next Listen is out November 11th, wherever you get your podcasts.
Joe, are there aspects of the media and social media and perception that you notice might affect your work in a certain way that you would want to see changed or feel like you can use in a way to help?
I think Freedom named it in that the narrative shift kind of strategy is it's not just like for the funders, or it's not just for, right? Like, yeah, I don't know that as a field that we've done a great job of it, right? Because we just had folks kind of head down, like kind of doing real community work. And we got an entire field of professionals that don't want the credit, right? Like that's their MO, is that they don't want the shine. They don't want the appreciation.
They do it.
They just do it because it's in them. And,
it's their life.
Yeah, that's right. Right. It's purpose driven. It's like not about credibility or, the accreditation. But we have to get better at that. We do, because the work that folks are doing in these street teams, that Freedom's teams are doing, is one, it's highly skilled, really complicated, work around kind of like assessing and, intervening and, intensive case management, highly clinical, highly skilled work that takes a long time to really hone and do really well. And I think there's lots of opportunities for us to be able to highlight some of that, right? Like there's magic there that we don't often talk about enough. And there's a lot of learning that I think we can take from, some of the experience and expertise of the folks on the ground.
And there's some beautiful, I was really privileged to be a part of the, Leadership Academy that, in Chicago, and 31 different cities were in it. And, it was amazing. But we did some work around common language, because we're looking, the White House, we're because of the White House office with Greg and the folks down in DC, we're actually looking at, how we share language to express the good stuff. So you're not talking about the same thing a different way. So we're bridging those gaps. And one of the things that is happening, we're doing this podcast, media, and they're giving us the opportunity to talk about this from a shared language thing, from what Kim is talking about, the good work. So that stuff is happening. And like he said, the men and women who are doing this work see this as their life. It's like, the music industry, I heard Erica Ford in New York talk about this work, and Chico, they're talking about this as an industry now, because, it's not just a program, it's not a model, although we are using models to measure effectiveness and strategies to be able to duplicate things that we know work and train to become better. But this is an industry. Mm-hmm. And in an industry, you have people who are experts, the ground, you understand? And the industry is now catching up with language to reflect what has actually been being done for a long time. Right. And so with that being said, the men and women who have been doing this work for a long time, now we're able to explain a little bit about what they've been doing, because it's their life's work. Absolutely. It's a new industry.
And to that point, I think, and this is, this is a whole nother topic, but research, our field has to do research in a way that I think honors those folks, honors the long legacy of community organizing. Really, that's what it is, community organizing work. And healing work, that folks have been doing for 40, 50 plus years. And now academia, science is catching up to it, right? Like what folks have known for a long time is like community is healing, and we need, kind of peer supports and, those kinds of things that are like it seem to be, mind-blowing new technical concepts, but that folks, have been employing for a really long time.
And I love that the research thing, that's, we have to show validity. But the research shouldn't change it. You understand? Mm-hmm. And we have to be extremely cautious because, we want to have policies that are, this healthcare system, LifeBridge Health, and I'm using this. I use the square peg in a round hole analysis. Mm-hmm. So this healthcare system took on all these street teams, right? We have a hospital responder teams, we have street teams, we have trauma teams, we have training components, we have healing spaces. They took on all these staff and they're all healthcare workers. We didn't know that the policies, the procedures were not conducive to getting the work done. So if this healthcare system doesn't change its policies, because some of the policies are not geared for Black and brown street teams. So if we don't change the policies to reflect and to support the work, then it is not a good fit. So what we are recognizing, and it takes a strong healthcare system to be able to say, let me change my policies and my structure to fit this component.
If I could share an analogy around that I heard that really stuck with me is that, there's been in Black and brown communities historical trauma with medical institutions, right? Like without going into the long history of that, that's real, right? Like folks in the community don't like going to the hospital because they get treated like dirt, because they've had negative health outcomes. Folks don't come out sometimes, right? Yeah. That's a reality of the history of trauma.
Their pain is invalidated.
That's right. All of that, right? And there's plenty of research that kind of speaks to that. And, I think a fundamental shift that I think Freedom is talking about is rather than hospitals asking, what can we do so that people will trust us again? Like, how do we improve public image? How do we improve our PR strategy? Yes. It's the shift is, what do we need to do to earn that trust? Right? Like, what do we need to do as a healthcare system to be deserving of people's trust? And that's a fundamental shift in your approach. And I think what Freedom is talking about is that transformation of the medical system, to be more meaningful, at addressing people's needs.
LifeBridge has a tagline, care bravely. And I tell them all the time, this is what caring bravely looks like, because not a lot of hospitals will take 50 men and women who are on the streets because it is risky, mitigating violence. So it is about caring bravely in action to help your communities know we are co-partnering with you.
Yeah. I mean, to talk more about you guys' partnership, because Joe, you're organizing with hospitals all over the country, to make these changes and to, try to create a standard of care, for people. And obviously, there's going to be unique challenges and gaps in that because it's not a one size fits all approach. And so, is that the sort of genesis or strength in you guys' partnership? Is that kind of what brought on that partnership, is trying to create that standard of care across the country?
I wouldn't say like, at least from, I think from, speaking on behalf of our organization, I feel like there's something that we gain from having partners like LifeBridge, like the folks in Baltimore, right? That, we just get to talk about the great work that is happening on the ground, right? Like, and we get to learn from the partners that are doing this work and being able to share that with other folks that are starting off in their communities. So, I think there's something there around the relationship, that we work hard not to just be like, let's parachute in, drop off this training and dip out. But really,
No, this is a partnership. So for me, when we became a member of the hobby, for me, I was like, okay, this is great. And now I can speak from experience what I've gained. So I I've gained a collective consciousness. So there's other hospitals that are in this network that I can connect with. There's the training, which is the obvious, but there are policy groups. There's different groups that different skill sets within the hospital structure, within a CVIP, community violence intervention program, can join in the hobby to become better at talking with people in this field doing the work. I have used them because, like I said, although LifeBridge, Sinai's, and they've been doing this work for a while, but now I can say, help me talk to the leadership at LifeBridge from what hospital in this network has a policy that can help me change HR, or help me connect with some nurses and doctors that can talk to some nurses and doctors who need to understand what this work is about. So there's actual collaboration, there's actual shared knowledge, there's actual depth and statistical information. This to me is a huge partnership. We have to organize and teach advocacy on the ground. So it's about partnerships. I can go off on organizing another time, but that's what you call sustainability.
No, so that's a great answer. Thank you, guys. I mean, this has been such a great interview, and I want to be mindful of your time. And I have a few more questions. Thinking about the work you guys do and the needs you guys have independent of each other and you guys' partnership. If you guys had, genie in a bottle, you get one wish to get this one thing that like if I just had this one thing that I could add to my work or my organization, it would change so much. What is the most important or most significant thing you both need that would just further or help your work so much?
I know the answer for me. I'm very grateful, and I'm sharing this because about 4 weeks ago I had a TIA. A TIA is what you consider a little bit of a mini stroke, right? And I have been doing CVI work like many people in this field for a very long time. There are many people who start because they're great at this in the street. They bring trauma to the work right up front in the door. The one thing that holds us back from even doing great or greatness is health, wellness, and resiliency. If I could ask for anything, I would ask for that to be on the forefront of any program within the infrastructure of all programs with people doing any type of CVI work. What does that look like? That means health, wellness, resiliency for public health workers is similar to what we say the police department has for its people. So if our team is seeing trauma and have too much trauma, they get to be on administrative leave with pay like other folks. So there's a focus on health, wellness, and resilience so that our people can do greater good. That looks like changing some legislation. That looks like putting the dollars into health, wellness, and resiliency in systems that do this work. Because hurt people can't help people. Empty cups can't give you nothing.
Yeah.
So we're making an impact be a little empty, but we don't want to lose people to this work. I'm going to be I'm challenging all people who are executives doing this work. Pour into you. I decided I want to be the example. A sister from LA who does this work, she said to me, Freedom, don't be the example of dying in this work. Be the example of living in this work. De-stress. Meditate. I got a health coach. All my team going to exercise. So I would suggest that we need to put the focus on that.
Amazing.
I'll triple down on that. The front line is all we have, right? This field does not exist without the front line.
Yes.
And we need to quadruple down on the sustainability of front line. The unfortunate reality is a short shelf life for frontline workers. And that's because they every single day are up against tremendous odds. And we need to figure out how to even those out as much as possible, whether that's through pay equity, whether it's through competitive benefits, whether it's through mental health supports. There's just so many things. One thing that stuck with me is a few years ago, we had Dr. Ibram Kendi speak at one of our conferences, and he said 3 things that frontline workers need is resources, opportunity, and political protection. And I think that especially at a time where folks don't necessarily understand or value the work of frontline workers, we need to protect their energy, their time, and support them, right? Meaningful professional development opportunities, wellness opportunities. And like, this is, I'm from California, so I got a little bit of the avocado toast in me, but we need we need yoga. We need like all of the things, right? Whatever it is that folks, that will help folks get to a place of more wellness. Like, we need to be able to invest in those things, and not consider it as like a bonus to the work, right? Like, that's not a health benefit.
Right.
That's just to help you maintain and stay sane. You should be getting access to free mental health services that are culturally relevant, that are, like, those things cannot be additions to, they have to be a core part of the work and plan for sustainability.
Yes.
Amazing answers. Thank you guys so much. Jo Kim, Associate Director for Community of Practice at the Health Alliance for Violence Intervention. Freedom Jones, Director of Community Violence Intervention Programs at Center for Hope. Jo, Freedom, thank you guys so much for such an amazing, informative interview.
Thank you.
Thank you.
And
Thank you.
we can't wait to get this out to the world and spread you guys' message and your work.
Thank you for doing it.
Thanks for the opportunity.
A special thank you to the Coalition to Advance Public Safety for making today's conversation possible. To learn more about how they foster transformative CVI ecosystems and the individual organizations that work in this coalition, visit www.capsinitiative.org. That's www.capsinitiative.org. This series is produced by Associate Producer Donnie Matias. Our supervising producer is Jamila Zara Williams. Mixing and sound design by Noah Smith. Steve Nelson is our SVP of Weekly Content. Executive producers are Stephanie Whittles-Wax and Jessica Cordova-Kramer. And please help others find our show by leaving us a rating and leaving us a review. Thank you so much for listening, and we will see you next week.
Are you looking for ways to make your everyday life happier, healthier, more productive, and more creative? I'm Gretchen Rubin, the #1 best-selling author of The Happiness Project, bringing you fresh insights and practical solutions in the Happier with Gretchen Rubin podcast. My co-host and happiness guinea pig is my sister, Elizabeth Kraft.
That's me, Elizabeth Kraft, a TV writer and producer in Hollywood. Join us as we explore ideas and hacks about cultivating happiness and good habits.
Check out Happier with Gretchen Rubin from Lemonada Media.
Hi, everyone. Gloria Riviera here, and we are back for another season of No One Is Coming to Save Us, a podcast about America's childcare crisis. This season, we're delving deep into 5 critical issues facing our country through the lens of childcare: poverty, mental health, housing, climate change, and the public school system. By exploring these connections, we aim to highlight that childcare is not an isolated issue, but one that influences all facets of American life. Season 4 of No One Is Coming to Save Us is out now wherever you get your podcasts.